I'm excited to announce to introduce our speakers for today's webinar. So first, we have Dr. Kira Werstein, teaching professor, kinesiology, Master of Digital Health Program Director of Graduate Education. She specializes in health, wellness, and behavior change courses. In addition to teaching, her professional mission is to translate research into practical solutions, which she achieves through various roles, including serving as a faculty member and as a clinical health coach and consultant. So welcome, Kira. We also have Dr. Kristen Metcalf, Assistant Teaching Professor of Kinesiology for the Master of Digital Health Program in the Department of Kinesiology for Iowa State University. Her expertise spans health and wellness, physical activity measurement, and wearable technologies. Welcome, Kristen. And finally, we also have Dr. Michelle Rusch, Assistant Teaching Professor of Kinesiology for the Master of Digital Health Program in the Department of Kinesiology here at Iowa State University. She has an extensive background in using simulation in healthcare, developing mixed reality applications to offset the effects of fatigue and cognitive and visual impairments. So welcome, Michelle. So this will be a quick informational webinar about our Master of Digital Health program at Iowa State University. We'll have plenty of time for questions at the end, so encourage you to submit those along the way in the chat feature as we go along. So first, we'll give an overview of the program, quick information about the curriculum. We'll also discuss career opportunities in digital health, the online learning experience, and the student support and services available to online students at Iowa State. So let's get into it. Kira, can you start by giving us an overview of the Digital Health Master's degree?
Yes, thank you, Megan. This program teaches students to use digital tools and data analytics to improve human health outcomes. Using information and communication technologies, it equips them with skills to manage health behaviors, illnesses, and risks. The learning objectives for the program include integrating digital technologies, analyzing data, and incorporating innovative technologies. It combines understanding digital health technologies with expertise in human movement, health behavior, and health promotion. Students will have hands-on experience, learn digital health tools and data analytics, and have opportunities to work on real-world digital health projects. Now I'll pass to Kristen to share more about the program's curriculum.
Thanks, Kira. So we've taken a holistic approach to the curriculum, so blending technological innovation with health sciences for more advanced digital health interventions. Our program is designed for working professionals, so we offer a flexible online learning format that Michelle's going to talk a little bit more about.
Thanks, Kristen. So the program involves 30 credits. And this breakdown includes 4 credits of foundational courses and 24 credits or 8 specialized courses on data analytics, AI, personalized medicine, telemedicine, public health, and more. 2 credits are dedicated to a capstone project. The 2 foundational courses are Foundations of Digital Health and Research Methods and Ethics of Health Technologies. The Foundations of Digital Health course explores the intersection of technology and healthcare. It covers the evolution of digital health, agile methodologies for personalized interventions, and the impact of innovation and entrepreneurship on healthcare efficiency. The Research Methods and Ethics of Technologies course covers research methods in the digital health ecosystem, including quantitative and qualitative approaches. It explores ethical considerations and regulatory aspects of health technologies like wearables, apps, and social media platforms. The foundational courses will set the stage for our specialized curriculum. For example, students will be inspired with concept ideas and methods for developing projects in focused areas. This work can later be showcased in a portfolio that will help them be competitive in the job market. Finally, the capstone project gives students real-world experience relevant to their careers in the digital health field. It can be an internship with industry partners, campus partners, research labs, or healthcare organizations. It could be a meta-analysis or an analysis completed individually or in groups, and it will involve documentation and a presentation to faculty and students. Now, Kira will share a bit about what students can expect the program to be like.
All right, thanks, Michelle. So students can expect to spend about 2 to 3 hours per week for each credit. So that would mean, for example, a 3-credit course would generally take a student about 6 to 7 hours per week. Each course will also vary in the types of activities and assessments and the expectations of those. So you could expect things like quizzes, applied activities, presentations, and projects, all of which are in our learning platform, which is called Canvas. Students in our current cohort have interests in the future careers that involve, for example, healthcare IT, health data management, data-driven decision-making, insurance, and product development and strategy. So with that, Michelle, I think we're ready to hear a little bit more about career potential and with a degree in digital health.
So digital health has real-world applications across various sectors. Examples include enhancing patient care and operational efficiency in healthcare, developing innovative health technologies, and optimizing medical devices and systems and engineering. Our program equips graduates to be competitive and excel in various areas where health and technology converge. This degree will distinguish students in the following areas. One, healthcare IT and telemedicine. This involves telecare, activity monitoring, and remote medication management roles. Two, mHealth apps, and this would involve development and management of wearables, glucose monitors, activity trackers, and fitness apps. Three, monitoring services such as solutions for independent aging, chronic disease management, and post-acute care. And four, health analytics, including opportunities with health insurance companies, software, and product engineering and web application development. A degree in health, a degree in digital health opens up opportunities in a variety of fields, from managing risk and improving health outcomes to advancing drug development and delivery. You could also have the chance to lead data-driven health research, shape impactful health policies, and promote population health and disease prevention. There are a wide variety of applications for which you can use this degree and for which you will be prepared. The AMA presented a report recently of anticipated healthcare technology transfer 2025. They highlighted wearables, integration of remote patient monitoring into care models to facilitate chronic disease management, telehealth, tailored messaging, and AI to offset physician cognitive burden. They stressed the need for thoughtful implementation of these technologies that considers people, processes, operations, and workflows required to properly integrate tools in a way that they bring the most value. 50 years ago, physicians often had about 7 pieces of information to keep track of in an ICU visit. Now there are up to 1,300 data points to manage. Our program provides education and training on how to develop tools to collect, aggregate, analyze, visualize, and synthesize this data. These skills will set you up to be competitive in the job market. Along those lines, I will now pass it over to Kristen to talk more about the career opportunities.
The digital health field is rapidly expanding due to an aging population, increasing chronic disease rates, and just changes in consumer expectations. And employment in healthcare occupations is projected to grow with approximately 1.8 million openings annually. Careers in health information technology are expected to grow by 16% in the next 10 years, which is much faster than average growth for all other occupations. Specifically, there are 2 digital health professions that are among the U.S. Bureau of Labor Statistics 2022 fastest growing occupations. The first is medical and health services managers. So this field is projected to grow by about 28% by 2032 and has a median pay of over $104,000 per year. Secondly is an information security analyst, and this field is projected to grow 32% by 2032 and has a median pay of $112,000 annually. The healthcare and social assistance sectors are expected to drive employment growth in the United States, accounting for about 45% of all projected job gains between 2022 and 2032. And by 2026, which is next year already, there will be a significant shortage of health aides and medical assistants, which is going to make professionals who have digital health experiences or expertise exceptionally valuable. Our program prepares you to offer accessible, efficient, and personalized patient care, ensuring job security and ongoing learning opportunities in this field. We'd love for you to join us and become a leader in digital health, contributing to innovation in healthcare and research. So let's take a look at what your return on investment would look like by joining us in this program. The salary range for this field is wide, as post-program pay varies depending on a lot of different factors. So your experience, your geographical location, and your previous education can all significantly influence your earning potential. However, the range also indicates that there's plenty of room for growth as you gain experience in the field. In addition to the promising return on your educational investment, your tuition after scholarships alone would stand at $20,700. And this is a sum that could potentially be repaid within your first few years of employment after you complete the degree. Also, if you're currently employed, you could possibly reduce your out-of-pocket costs even further. So be sure to look into your company's benefits package to learn about any educational reimbursements that they may offer. So with that, Megan is going to round out the content portion for us.
Thank you, Kristen. So first, I would like to let students know that there is a dedicated person in the program to help with any questions that students may have. Amanda Flynn. Amanda Flynn provides student support for the program. She's one of your go-to contacts, can help answer questions and connect you with other university services that you might need as you navigate through your time in the program. So I imagine you'd be in communication with Amanda on a fairly regular basis. So thank you, Amanda. And then other information that you may be curious to know. So admission to all graduate programs at Iowa State University require a 4-year degree or equivalent from a regionally accredited institution. Your previous degree does not need to be in a closely related subject area. Academic records or transcripts need to be submitted with your application to the program. And the graduate college requires applicants to have and maintain a minimum 3.0 GPA, but the program may alter that requirement. Additionally, any non-native speakers of English must demonstrate their English proficiency. This program utilizes a rapid admissions process. So applicants are evaluated and admitted to the program within 7 to 10 days of applying, which is just fantastic. With this program, you can enroll to start taking classes in August, January, or May. When you are ready to apply, you'll use the graduate application at iowastate.edu. The application fee is $60 for domestic students and $100 for international students. However, if you do decide to apply, the college will waive your application fee. You just need to let us know that you've gotten that application started, and we'll be able to waive that fee for you. I also want to add that we have seen interest from students that are using the program as kind of like a gap year before medical school. So if you're in that position and considering a gap year, this program could be an excellent way to boost your application to med school, dive into digital health, and build up some real world experience that would set you apart from other applicants. Additionally, students in distance education programs at Iowa State University benefit from a distance education tuition rate no matter where you reside. You are assessed a mandatory technology fee, and that kind of varies per credit hour. Students that are enrolled in these types of programs are not charged other student fees, such as the activity and service fee, health fee, or health facility fee. Iowa State University does offer a deferment option for employees of businesses or organizations that provide that tuition reimbursement. So Kristen mentioned that. So look in if you are currently employed, perhaps your employer would offer some sort of deferred payment or help pay for your participation in this program. And additionally, this program is offering up to $1,800 in scholarships for students who enroll in this academic year. And we can get you more information about any of those things if you reach out to either Amanda Flynn or to my team at Iowa State Online. And finally, there are lots of things that are available to you at Iowa State University if you're an online student. So we offer many academic, career, and well-being resources to help support students. from the Center for Communication Excellence within our graduate college to mental health resources like telecounseling and well-being coaching. We're really committed to supporting your success in every aspect of your university experience, and we'd be happy to connect you with any of those resources once you are a student here.